Welcome to the Nclex Crash Course. In this
The digestive tract is a long muscular tube that moves food and accumulated secretions from the mouth to the anus. So as we can see here that this is a tract which is a long muscular tube. So all of us know that it is a long muscular structure that will help in moving the food. So it starts from the mouth and it will help in moving the food downwards. That's why it is a muscular tube. And it also accumulate the secretions from mouth. So mouth release, secretions and hormones which are accumulated with the food, and it move from the mouth to the anus. The GI tract includes all structures between the mouth and the anus. So the structures, whatever structures which are included between the mouth and the anus comes under the GI tract. The only thing we have to remember here is that it should participate in the digestion. So there are lungs also in the, between the mouth and the stomach. The lungs also, stay there, but they are not the part of GI tract because they do not help in digestion or absorption of food. They do not play a role in the food, functioning. That's why, let's see here. So the tract is divided into upper and lower tract. Okay, so we can see here that GI tract will be divided into the upper GI tract and lower GI tract. The upper GI tract consists of esophagus, stomach, and duodenum. So we can remember this by ESD, that in upper GI tract, there will be esophagus, that will be a hollow pipe that will help in moving of the food from mouth in the flow of gravity towards the stomach. Then there will be stomach which will store the food, and duodenum, that is the first part of the small intestine. The lower GI tract includes most of the small intestine. So the jejunum and ileum part will be under the small intestine in the lower GI tract, and all of the large intestine. So lower GI tract contains small intestine and large intestine. The exact demarcation between the upper and lower tract is the suspensory ligament of duodenum. So when we talk about the exact demarcation which divide the upper and lower GI tract will be the ligament of duodenum, and it is known as the ligament of Treitz. We have to remember this. This is a very important thing, that ligament of Treitz will divide upper and lower GI tract. In this slide, we will see where the ligament of Treitz lie. So this is exact where the ligament of Treitz lie, and that divide the upper and lower GI tract. Now moving on to the functions of GIT system. So before moving on to the major disorders of GI tract, we have to know that what is the function of GIT system in our body. So first and most important function is digestion. So whatever we eat, whatever food we intake, that is ingested in our body, and that food is absorbed and metabolized in our body. So digestion is changes to food in alimentary canal occur, so it can be absorbed and metabolized. So if you take the solid food, it is by the mechanical digestion, it is converted into the semi-solid or liquid content due to the process of digestion, and that change in the consistency of the food that we ate is known as mechanical digestion. This is a small thing that you can remember. These are the small points which can help you to understand more about the digestion process. And the chemical digestion is where the hormones and the chemicals are involved, which help in the absorption of the food. So this was about digestion. Second thing is absorption. Now, when we have taken the food, that food is converted into, more digestible form, that is semi-solid form. Now, these small molecules from the food source these will go through the intestinal mucosa. So there is the intestinal mucosa, and these small food particles will enter this mucosa, and the very important contents, all the nutrients will go through this mucosa. So this is absorption. Whatever nutrient we intake, that is absorbed through the intestinal mucosa. So that is called absorption. Third thing is metabolism. So this is also the function of GIT tract. What is metabolism? It is sum of all chemical reactions engaged in energy production and expenditure. So for example, if we ate an egg, that egg will be converted into more digestible form, like in a semi-solid form. After that, it will be absorbed by the entire intestinal mucosa. So in egg there is a good amount of protein, so that protein will pass through the intestinal mucosa, and it will be used as the energy production source and energy expenditure. So that protein will help in production and expenditure of energy. So this is metabolism. Whatever we ate, that leads to the chemical reactions which helps in energy production and expenditure. So these were the very important function of the GIT system, which are very, very vital and very crucial for our body. Without these functions, a person cannot survive. So here we can see the whole digestive tract. It starts from the oral cavity, then there is a long hollow tube which is muscular, that is esophagus. So the food start from here, move with the gravity, and is stored in the stomach. So in front of the stomach there is the liver, and just below the liver in the back side there is a gallbladder, and this is the stomach. After that the small intestine starts, so with the duodenum, and here is the pancreas just behind the stomach. This is the large intestine, and this one is the small intestine. The small intestine is much longer than the large intestine. This is the appendix, this is the rectum, and this is the anus from where the excreta gets out of the body. So this was a review of the GIT system. Now let's move on to the disorders of the GIT tract. So first is obesity. So we will study about obesity in the first place because it is a major disorder in the GIT tract, or we can say related to the GIT tract. So obesity is a medical condition sometimes considered as a disease in which excess body fat has accumulated to such an extent that it may negatively affect the health. So we can see here that in obesity, there is excessive accumulation of fat, and accumulation of fat is to such an extent that it start causing harm to the health. So everything is in excess will cause harm to our body. So everything should be in balance. Excess of anything can lead to harm effects on the body. So if more eating is done, if there is a sedentary lifestyle, so fat accumulation can lead to negative effects on the health. People are classified as obese when their body mass index, that is a person's weight divided by the square of person's height, is over 30 kg per meter square. So when the person is called obese, when the range of BMI is above 30 kg per meter square, so that person will be called obese. So if there is a mentioning of BMI, so we will see that in what sequence we categorize the people in the obesity. So when we divide weight of the person in kgs by height of the person in meter square, so whatever result comes, it comes in the kg per meter square. So if value is less than, so we will see here, if value is less than 18.5, so that person will be called, or we can say that weight status of that person will be underweight. So BMI less than 18.5 kg per meter square will be underweight. If the BMI is between 18.5 to 24.9, so this person will be of normal weight. If BMI is between 25 to 29.9, so this person will be called overweight. It means that this person is not obese, but he or she will be prone to obesity. So you have to closely watch this person so that this risk factor can be modified. If the BMI is between 30 to 34.9, so the weight status will be obese and the degree will be degree 1. So if the BMI is above 30, it means here the obesity starts. So this obesity is categorized under 3 levels. So mild, moderate, and severe. Mild means the BMI will range between 30 to 34.9. Moderate when BMI is 35 to 39.9. And when BMI is above 40 kg per meter square, so that person will be considered as morbid obese. So this is the category in which we differentiate the weight status of the person. Now moving on to the etiology and pathophysiology. So what is the etiology of obesity and how obesity is, what is the pathophysiology, how it occurs? So when the caloric intake exceeds metabolic needs, so if a metabolic need of a person is 2000 kilocalories per day, but he consumes more than 3000 kilocalories per day, he eats junk food and do not exercise, so he is consuming extra calories. So that extra calorie will lead to deposition of fat, accumulation of fat all over the body, and that can lead to the obesity. So this is the etiology, that is calorie intake will exceed the metabolic needs. It is a complex illness involving metabolic, genetic, and psychological factors. Okay, so obesity can be due to many things, like it can be related to the metabolism. A person may have poor metabolism, and genetic reasons. So the family history is of obesity. The family tree is all people have obesity as their problem. Third is psychological factors. So there may be some psychological factors, like if person is depressed and person takes too much stress, so that person tends to eat more, and that eating more can lead to the obesity. And there are also involvement of the regions. So 30% of the African American and Hispano American adults are obese. 25% of the European American adults are obese. So it also depends upon the region. Research indicates that a stomach hormone, ghrelin, so ghrelin is a hormone which triggers the hunger and may be a significant factor in managing weight for a small number of obese clients. So there is a possibility that in some obese client there may be decrease in the ghrelin factor, or ghrelin factor will be not that much active. So ghrelin is responsible to trigger the hunger. So this will be it will be increased. So when ghrelin factor will increase, so the person will tend to be more hungry. The hunger level will increase. So that can lead to obesity. And obesity is a major risk factor in coronary heart disease. It can lead to many problems. It can lead to complex of the disease in the person. So it is a major risk factor in coronary heart disease because there will be accumulation of the fat in the arteries, which we can see arterio or atherosclerosis. Brain attack. So extra accumulation of fat in the brain vessels can lead to brain attack. Hypertension. So when there will be accumulation of the fat, deposition of cholesterol in the blood vessels, so there will be increased pressure in the arteries and can lead to hypertension. Diabetes, arthritis, asthma, bronchitis, and decreased respiratory function. Okay, so all these things can occur due to obesity. Obesity may increase risk of endometrial, breast, colon, kidney, and gallbladder cancer and degenerative joint diseases. So obesity can lead to all the diseases that are mentioned here. So it is very important to control the obesity in the client. Research shows that obese clients are leptin resistant. So here comes a new term. It is a hormone, leptin. Leptin is thought to communicate to brain when stored fat is sufficient and food intake should cease. So leptin is a hormone that will provide signal to the brain that the body do not require more food. So it is a hormone that will make us feel the satiety. The person will have satisfaction after eating food. But if we talk about the obese people, so there may be decrease in the leptin hormone, or leptin hormone may not be working well. That's why they tend to eat more. They do not get the signal from the brain that yes, their tummy is full. That's why the obesity can occur. So all these are the various factors, for example, genetic factors, metabolic factors, psychological factors that can lead to the obesity. Second is clinical findings. In obese person, what we can find? What are the, we can say clinical features in the obese person? So first is the subjective. What the person or patient will inform. What will be the information given by the patient? So patient will tell there is undesirable eating pattern. Undesirable indicates that patient do not desire, patient do not wish to eat like this, but patient has no control over that. So that's why that is undesirable eating patterns. The patient will feel more fatigue. Okay, so the energy level will be low. Feelings of low self-esteem. So it is very common in society, that is body shaming. So that body shaming can lead to feeling of low self-esteem, depression, and disturbed body image. So all these things will be reported by the client. Second is objective data. The data that we will obtain. So that is obtained by the healthcare professional. Okay, so what we are going to see, how we are going to, find out that the person is obese. So if there is 20% or more over the ideal body weight, so when the fat or we can say the weight is 20% extra than the ideal body weight. So we can take an example. If the person height is 152 centimeter and the weight is 60 kgs, so the calorie requirement is 2000 kilocalories per day. But if we intake more calories, so that can lead to obesity. And if the body fat of that person is 20% more over the ideal body weight, okay, so that will indicate the obesity. Second is morbid obese. When we can say that person is morbid obese, so when 100 lb or more over ideal body weight, so when the body weight is 100 lb additional or more, so that will be morbid obese. Tricep skin folding greater than 15 mm. So tricep, if there is a fat accumulation in the tricep more than 15 mm in the male and more than 25 mm in women, so those people will be called obese. Observed dysfunctional eating habits. So when we observe that there are, abnormal eating habits, there is binge eating. So that person will be categorized under the obese. behaviors that indicate low self-esteem, depression, and disturbed body image. So all these features can be seen in the person who is obese. Now moving on to the therapeutic interventions. What therapeutic interventions we can provide to the person who is obese? So in these patients, we can induce weight reduction diet. So the diet that has low calories and high protein, low fat, and low carbs, or we can say moderate carbs. So that kind of diet will be provided. More fibers the patient has to take. So all these things the patient should include in the diet so that the fat accumulation will reduce and the normal or ideal body weight can be attained. Exercise program. So along with the dietary pattern, the exercise should be involved. Exercise will lead to increased strength and increased cardiovascular health in the person. Behavior modification, this is very very important. If we tell the patient to follow a diet or exercise program, so it may not last for life. The person may follow that diet pattern or exercise program for a short duration. So it is very important to do the behavior modification. We have to indulge these activities for the long term. We have to make sure that patient knows that when to eat and how much to eat. So all these things should be done. Pharmacologic management, how we can include medicines and why we need to include medicines. So when there is a morbid obesity or a high degree of obesity, so appetite suppressants may be given. For example, sibutramine, that is called Meridian, multivitamins, because due to appetite suppressing there may be deficiency of the nutrients, therefore multivitamins can be given. Antidepressants. Okay, so though we can see that in obese people, depression is seen very commonly due to disturbed body image. Therefore, antidepressants should be given. Lipase inhibitor. Lipase inhibitor, for example, Orlistat, that is Xenical or Eli. These are the brand names. These are also given. So lipase inhibitor will help in decreasing of the fat accumulation. And moving on to the further interventions. So for morbid obese people, bariatric surgery is recommended. In bariatric surgery, the fat is removed from the body. And there are, various type of the, types of the bariatric surgery. First is gastric bypass. So how we remove fat? What is the method? So it is not removed directly. There are various things, various modifications done in the stomach, in the GI tract, so that there will be change in the dietary intake of the person. So in gastric bypass, stomach capacity reduced to less than 50 ml. So in gastric bypass, what is done that this is the stomach and this is the small intestine. So the bypass is made between the esophagus to the directly to the small intestine, and maybe due to half of the pouch will be stitched, and only a narrow tube and small pouch will be there left. So there will be small space to store the food, and the patient will feel satisfaction and hunger satisfaction very soon. So appetite will decrease and the stomach capacity will reduce to 50 ml. Proximal jejunum is transected and distal end anastomosed to newly created stomach. Proximal stomach is anastomosed to jejunum. So all these modifications are done so that the stomach capacity can be reduced. Second is laparoscopic adjustable banded gastroplasty. So in this, there will be a band that can be adjustable, that will be applied on the stomach so that to create a small proximal stomach pouch, adjusted externally reversible. So in this condition, in the stomach, there will be a band applied which can be tightened or loosened according to the physician's consultation or physician's advice. So it will narrow the stomach and it will decrease the capacity to store the food, and with some time the adjustable band will be loosened. So this is known as laparoscopic adjustable banded gastroplasty. Next is body contouring surgery after weight loss. So after the weight loss, lipoplasty to remove fat deposits. Okay, so after the weight loss, what happens that the fatty skin tends to tends to be there on the body, and that is it it should be removed because it looks very bad. So lipoplasty to remove fat deposits, paniculectomy to remove excess abdominal skin folds. Women of childbearing age should not become pregnant before surgery and for at least 1 to 2 years post operatively. So all these things we have to remember here. So body contouring is also very common nowadays, so that the shape and the skin, should be equal all over the body. Now, moving on to the health risks associated with obesity. What are the risks which are associated with the obesity? So, first is the cardiovascular. In obese patients, hyperlipidemia will be seen due to excessive accumulation of fat, due to excessive consumption of cholesterol. The lipid level will increase in the body, which can lead to hyperlipidemia, and that will block the arteries of the blood. That can lead to heart attacks. So, sudden cardiac death can be seen in these patients. Right sided heart failure. So, due to poor circulation of blood, due to accumulation of fat, due to accumulation of lipid in the arteries, there can be right-sided heart failure. Left ventricular hypertrophy. So this can be also seen due to accumulation of the lipid. Coronary artery disease. So, atherosclerosis is, due to coronary artery disease. So this is also due to accumulation of excessive fat. Deep vein thrombosis. So due to excessive accumulation of fat, they will be reduced in the circulation, which can lead to pooling of the blood. So there will be pooling of the blood in the veins, which can lead to deep vein thrombosis. Atrial fibrillation, hypertension, cardiomyopathy, venous stasis. So all these things are the, complexion, or we can say the, adverse effects, we can say health risk associated with the obesity. Second is on the musculoskeletal system. So what is the risk on the musculoskeletal system? So there can be osteoarthritis, impaired mobility and flexibility. So due to obesity, due to, increased weight, due to very heavy person, they will be increased weight will lead to increased pressure on the joints, and there will be increased pressure, so it can lead to osteoarthritis. Impaired mobility and flexibility. So when there will be heavy body, so patient will be less flexible and not able to, walk properly. Gout can occur. So increase in the uric acid can lead to gout, and it is also related to the obesity. Lumbar disc disease. Due to heavy body weight, the bone can also get affected, and the lumbar disc disease is very common. Chronic low back pain. So this is also related to the heavy weight. Respiratory system. So in respiratory system, obesity hypoventilation syndrome. So due to obesity, there can be hypoventilation, which means there will be decrease in the ventilation. Patient will be not able to ventilate properly. Sleep apnea can occur. So in obese people, it is very commonly seen that there will be blockage in the nasal passage, which can lead to sleep apnea. Asthma can be seen in these patients. Pulmonary hypertension can be seen. And most important is the cancer. In obese people, cancer is a very big risk factor. Endometrial, breast, cervical, ovarian, uterine, and gallbladder cancer in women can be seen. Colorectal cancer in both genders and prostate cancer in men can be seen. So patients who are obese, cancer can occur in these patients. So they are at risk of the cancer. Metabolic. So in the metabolic functioning, type 2 diabetes mellitus can occur. Metabolic syndromes, polycystic ovary disease is very, very common, which can occur in the female due to, a bad lifestyle, eating a lot of junk food. So PCOD can be seen. Gallbladder. So in gallbladder and liver, non-alcoholic steatohepatitis, that is NASH, can be seen. So here, steato means fat. So due to excessive fat, there will be hepatomegaly and fatty liver, and that can lead to poor digestive health. Gallstones can occur. Genitourinary, end-stage renal disease, secondary to diabetes and hypertension can be seen. Stress incontinence can be seen in these patients. Reproductive. So in men, if there is, a great amount of obesity, hypogonadism can be seen. Gynecomastia, which means enlarged breast in the male, this can be seen. And hypogonadism means there will be decrease in the size of the testes and the gonads will decrease. Reproductive health in women. So what are the health risks in the female who is obese? So the menstrual cycle will be irregular, infertility can occur, gestational diabetes can occur, overdue births, induced labor and longer labors are seen very commonly in the females who are obese. Now, what is the nursing care of the clients with obesity? What nursing care we have to provide in the client with obesity? First is assessment. What thing we need to analyze? What thing we need to assess? So first is diet. We have to, recall the 24-hour, we have to get the information about the food that the patient has intake in the last 24 hours, which will help us to, gain the knowledge about the dietary pattern of the person. Food frequency. What is the food frequency? How many meals the person takes in a day? And food diary. So we can, it is very common that physician will tell the patient to, apply a daily diary in which the patient will record everything the patient has ate. Weight. We have to check weight of the person and exercise history. So we have to also know that if patient is active in the exercise or not. Family history of obesity. It is very important because obesity can be due to the family history. Emotions just before eating. So from the psychological aspect, we have to ask this because people may have, binge eating problem. That is anorexia bulimia. So that binge eating can be corrected by the emotional, or we can say by the behavior modification. So we have to know the emotions just before eating. Concurrent health problems and complications of obesity. We have to see that what are the complication in that particular person due to the obesity. Adherence to weight reduction program. We have to make the patient stick to the weight reduction program. We have to tell the patient to attend it regularly and consistently. So that's why we need to encourage and we need to motivate the person to stay consistent. Medication history for contributing factors. We have to know what medication the person was taking before. For example, steroids, because steroids can lead to weight gain. So all these things are very important to ask. Now we will see what planning we can do. So after gaining all the information, after assessing the patient, we have to plan the things. So we have to review diet and eating patterns to increase awareness of amount and type of food consumed and emotions that affect intake. So it is very important to review the diet, that what kind of diet the person is taking. We have to make a diet chart that the patient will follow. We have to, tell the patient about the eating pattern. We have to tell that the patient need to take small and frequent meals. Large meals should be avoided, and it is recommended to have, a light dinner, because in the night the metabolism gets slow and activity reduces, activity becomes zero when we sleep. So that's why the dinner should be very light. And we have to increase awareness of the amount and type of food consumed and emotions that affect intake. So we have to tell the client to do meditation, to do exercises, so that the stress should decrease, the stress will decrease, because stress can lead to binge eating. So all these things we have to keep in mind. We have to review high and low calorie foods, snacks, and beverages, determine how to achieve daily calorie intake. So we have to make list that what are the foods that are low in calories. We have to include these foods in the patient's diet. So we can include, leafy vegetables, which should be boiled or made in the less oil, or we can advise fruits, eggs, and many other things which are low in calories. Teach behavior modification techniques. For example, small plates should be used. So in small plates, the food looks more, and that's how the behavior modification can be done. Preparation of small portions, eating slowly and chewing thoroughly. So these small things can contribute in decreasing the satiety, decreasing the appetite of the person. Encourage daily walking program and supervise exercise program. So if a person cannot do much exercise, so daily walking program is also very helpful, and the exercise program should be supervised, so we can plan these things. Suggest opportunities to increase activity in daily life. So we have to tell the client that at least 10,000 steps per day should be completed. This is the recommended thing. And we can suggest that how the person can increase the activity. For example, the person should use stairs rather than the lifts. If patient wants to go to the local market, so he or she should go by the walk. There should be minimal use of the vehicle. And whenever you are, on the bed and you are using your phone, so you can use your phone while walking. So walk in the home. So this is how you maintain an active lifestyle. Support emotional needs. So this is very important. We have to support the patient emotionally. We have to listening is very important. We have to know that what the patient feels, what are the obstacles. Encourage counseling and participation in self-help group. So this is also very important. So there may be a group where there are many obese people, so we have to encourage the counseling and participation of the patient in that group, so that the patient feel familiar and he knows that there are many people like him and everything can be modified. Teach about modifiable risk factors for coronary heart disease. So we can tell the person that there are some modifiable risk factors that are under the patient's control. So risk factors can be modifiable and non-modifiable. Non-modifiable are like family history or genetic, and modifiable are like which are under the patient's control. For example, smoking should be reduced, alcohol intake should be reduced, and decrease in the junk food. And diabetes mellitus and strategies to minimize complications of diabetes. So all these things should be planned and implemented. Teach about medications. For example, lipase inhibitor can cause flatus with discharge, fecal urgency, oily evacuation. So all these things can be added in the patient's, emergency conditions or when recommended by the physician. Provide post-operative care after bariatric surgery. So after bariatric surgery, this is very important to provide post-operative care. So let's see that what is the post-operative care that is required after the bariatric surgery. So assess for wound dehiscence and slow wound healing associated with insufficient blood supply to adipose tissue and excessive skin folds. So after the bariatric surgery, we have to assess the incision for the wound dehiscence. Okay, and we have to check if there is slow wound healing associated with the decreased blood supply, because there are excessive skin folds, and so that can lead to decrease of the blood supply to the adipose tissue, which can lead to slow wound healing. So we have to assess for that. Instruct regarding use of abdominal binder. Okay, abdominal binder should be used. Ability to slip one finger beneath the binder easily. This is how the binder should be applied, so that the one finger can be slipped in the binder. Remove binder every 4 hours to assess skin for the irritation. This should be also done, that whenever the binder is applied every 4 hourly, skin should be assessed for irritation or for the decrease in the blood supply. Assess for obesity hypoventilation syndrome. So as we have discussed, in obesity hypoventilation syndrome, there will be decrease in the respiration, decrease in the ventilation due to obesity. Use devices to provide for safety and comfort. Okay, so we have to provide Safety devices for comfort. For example, large gowns should be given so that the obese patient can be comfortable. Large bed so that it can be spacious. That convert to chair also. Extra wide heavy duty wheelchair, walker and transfer board. Ensure accuracy of assessments. For example, correct size blood pressure cuff should be used. So for obese people, the cuff should be appropriate. Position in semi-Fowler position. Okay, so semi-Fowler position should be given. Use continuous positive air pressure ventilation at night if experiencing obstructive sleep apnea when ordered. Okay, so this is very important in bariatric surgery patient. Due to obesity, we have seen that sleep apnea can occur. So that's why there should be arrangement of positive air pressure ventilation whenever required. Provide medication in liquid form. So after bariatric surgery, for 2 to 3 days, there is the patient is kept NPO, and after that, there is the diet given in the form of liquid. So that liquid food, along with that, the medication should be also in liquid form. Encourage 6 small feedings, usually 600 to 800 calories daily, and fluid intake to prevent dehydration. So after the bariatric surgery, there is the chances of malnutrition and dehydration. Therefore, all these things should be managed by a proper daily intake of the calories and the appropriate fluid intake. So these things we have to apply. So after bariatric surgery, or in the 1 and 2 week, only liquid food is given. After the 2 weeks, the semi-solid food is given, and after 4 weeks, the solid food will be started very slowly according to the physician's advice. Encourage high protein foods and avoidance of alcohol, sugar, fat, and sweetened beverages. So all these things should be totally banned in the patient. Teach clinical findings of infection, deep vein thrombosis, dehydration, and obstruction, and need to immediately report these to the healthcare provider. Okay, so after the bariatric surgery, we have to teach the patient to look for any sign of infection, any pooling of the blood in the veins, signs of dehydration, for example, decreased skin turgor and obstruction, and need to immediately report this to the healthcare provider. Encourage to seek help with psychological issues. So whenever there are psychological issues, we will tell the patient to not hesitate and tell this to the healthcare professional. Bypass surgery. Teach regarding risk for anemia, and calcium and vitamin B12 deficiency may require lifelong nutritional supplementation. So after the bypass surgery, due to the decrease in the absorption of nutrients, there is a common deficiency of vitamin B and calcium. Therefore, a lifelong nutrition supplementation should be started, and this may require. What are the evaluation and outcomes? What we expect in the patient who is obese? So we expect that the patient achieves and maintain an ideal body weight lifelong. So this is a long-term goal. Therefore, behavior modification is very important. Verbalizes acceptance of self. So this is the first thing that we need to change in the client. You have to accept self as you are. And if you accept self, then you don't feel pressure on yourself, and you can change your behavior very easily. Remains free of injury. Maintain skin integrity. Demonstrate adequate depths of the respiration. So this was all about the obesity. Next disease is fracture of jaw. So this is the topic or the condition that we will study under the GIT tract problem. So what is the etiology and pathophysiology? So it generally results from trauma such as automobile collisions or physical combat. So fracture of jaw can occur due to trauma from the automobile collisions or physical combat. Blow or fractures of orbit may accompany fractured jaw, stabilized surgically with wires, plates, and screws. So after the accident, when the orbit is fractured, so this occur along with the fracture of jaw, and which is stabilized temporarily by the surgical wires and plates and the screws. Now, clinical findings, how we will get to know about the fracture of jaw. So in subjective data, we will see history of trauma to face, pain in the face and jaw, double vision. In objective data, we can see bloody discharge from the mouth, swelling of face on affected side, difficulty opening or closing mouth, malocclusion. So when there is fracture of the jaw, so we can see bloody discharge from the mouth, the face will be swelled on the affected side and the patient will not able to open the mouth properly and there will be occlusion in the jaw. So these are all the clinical findings we can see. Nursing care for clients having fracture of the jaw. So what things we have to assess in the client? First of all, we have to assess respiratory status for the presence of distress. This is the first thing we have to assess because the first goal of our is to maintain the respiratory patency. So this is the first goal. Second is we have to assess for nausea and potential for vomiting. This is also necessary because nausea and potential for vomiting can indicate the involvement of the neurological part. Structures of face and neck for clinical findings of edema. So we have to assess the face and neck properly so that we can see the edema or swelling in the other body parts and we can know that if other body parts are also affected. Drainage from nose should be seen or ears for the presence of CSF. So we have to see if the CSF is leaking or not because if there is leakage of the CSF, it can lead to infection of the cerebrospinal fluid and can lead to meningitis. Therefore, we have to assess for the drainage from the nose or ears and if CSF dries in the concentric rings, if there are concentric rings, then it is a hello sign, which means there is the sign of the meningitis. Moving on to the planning. So what is the planning and how to implement that planning? So after the fracture of jaw, we have to position the patient on side to reduce risk for aspiration pneumonia. So if the patient has fracture of the jaw, that patient will have less functioning of the mouth and that can aspirate the GI content. That's where we have to position the patient on one side to reduce the chances of aspiration. Control vomiting post-operatively. So after the operation, we have to control the vomiting, keep wire cutters at bedside to release wires and rubber bands if MSs occur. So the jaw is, tightened by the wires for healing. So whenever if there are chances of MSs, we have to always keep the wire cutter on the bedside to cut the wire. Suction the oropharynx if vomiting occurs. So we have to suction the oral cavity if there is vomiting. Establish alternate means of communication. So when patient is having fracture of jaw, so that in that case the communication will be impaired. So we have to find alternative method. This is very important from the nursing aspect. So we have to find alternative point of view. We can give a pen and a notebook so that patient can communicate via the writing or patient can use the signs, hand signs. Next is explain diet to client and family. Okay, so as patient has fracture of the jaw, so there will be a great big no to the solid food. Encourage the high protein liquids so that there is a proper healing and soft foods pure in the blender. Stress importance of oral hygiene. We have to always provide importance to the oral hygiene because the patient is having jaw fracture and will be unable to do daily brushing. That's why we have to tell that you have to always maintain the oral hygiene. You have to keep your mouth clean. You have to daily keep your mouth clean using the gauze piece and the mouthwash and instituted during post-operative period. Next is evaluation and outcomes. So what we will evaluate in the patient. So we will make sure that patient adheres to the nutritionally balanced, safe diet. So as patient will be at risk of the malnutrition and nutritional deficiencies due to not a proper solid food diet. So that's why we have to adhere the patient to the safe, balanced nutritional diet. We have to demonstrate the oral hygiene techniques. We have to describe technique for releasing wires and rubber bands if emesis occurs. So we have to also tell the technique that how to release wires and rubber bands if there is emesis. So these will be the evaluation and outcomes that we will expect in the patient. So in this video, we have discussed about the obesity and fracture of the jaw. These two disorders, or we can say conditions, we have seen in this topic. In next topic, we will see the cancer of oral cavity and other topics. There are many topics in the disorders of GI that we have to study. And this is all about this video. I hope that everything was clear to you. If there is any doubt, let me know in the comment box. I will provide with the response. And we will meet in the next video. Till then, keep practicing the questions, keep studying. Thank you.